Hello guys and welcome to my new YouTube channel Clinical Cases Simplified. So here we are going to discuss some clinical cases and their solutions. So let's dive right into our first clinical case study. A 45-year-old man presents to his physician for chronic arthritis which is worsening and affecting his lower back, hips and knees. On physical examination, you notice the patient's sclerae appear to have a brown discoloration. However, his vision is unchanged from prior examinations. His ear cartilage is similarly discolored. An X-ray of the spine reveals disc degeneration and dense calcification that is most prominent in the lumbar region. His urine appears normal at first but begins to darken with time. So, the main clues to our diagnosis are chronic arthritis, the discoloration of the patient's tissue like sclera and ear cartilage, and the most important clue, that is the darkening of urine on prolonged exposure to air. So, what could be our diagnosis? In this case, our diagnosis is Alkaptonuria, also known as ochronosis. So, what's the pathophysiology behind Alkaptonuria? So basically, Alkaptonuria is a congenital defect in the or absence in the enzyme homogentisate 1,2-dioxygenase or homogentisate oxidase that is required in the degradation of phenylalanine and tyrosine. So the phenylalanine and tyrosine are ultimately converted to the fumaric acid or the fumarate that is utilized in the Krebs cycle or the TCA cycle, but it occurs through multiple steps. In this case, we have this enzyme absent at this step. So there will be an accumulation of the previous product, that is homogentisate. This homogentisate is going to deposit in tissues, various tissues, and cause the symptoms that we can see in the patient, like the discoloration of sclerae, the ear cartilage, and the discoloration of urine. So the metabolite that accumulates in this condition is derived from which essential amino acid? The point to be noted here is they asked for the essential amino acid. So the essential amino acid would be phenylalanine. Why not tyrosine? Because the phenylalanine can fulfill the requirements of tyrosine by converting into tyrosine, but the tyrosine cannot be converted back into phenylalanine. So the tyrosine cannot replace phenylalanine. So homogentisate is a metabolite of phenylalanine. Homogentisate oxidase is necessary for phenylalanine degradation. Homogentisate is further metabolized to acetoacetate and fumarate, as we have talked earlier, part of the tricarboxylic acid or the TCA cycle. Given the extent of joint disease in this patient, how might his mental functioning be affected? So, Alkaptonuria is basically a benign disease. So, it has no effect on cognitive functioning. Also, Alkaptonuria is autosomal recessive. Aside from its effect on joints and discoloration of the sclerae and skin, the disease is benign. So, what's the treatment for this condition? There are no known ways to prevent the buildup of homogentisate. So what we can do is dietary restrict the intake of tyrosine and phenylalanine in order to reduce the production of homogentisate. But practically it is seen that this does not help. So what we do is conservative management. So treating the symptoms of the patient arthritis is the only recommended therapy in this case. Which amino acids are exclusively ketogenic? Which amino acids are glucogenic? And the third question will be which of the amino acids are both glucogenic and ketogenic? So the amino acids whose metabolites are converted into glucose are called glucogenic amino acids, and the amino acid in which the metabolites are degraded into acetyl CoA or that is further converted into ketone bodies are called ketogenic amino acids. So the leucine and lysine are the only purely ketogenic amino acids. Isoleucine, phenylalanine, threonine, tryptophan, and tyrosine are both ketogenic and glucogenic. The remaining amino acids are purely glucogenic. Glucogenic amino acids are those whose metabolites can be further converted into glucose through gluconeogenesis, whereas ketogenic amino acids are degraded into acetyl-CoA, which can be converted into ketone bodies or acetoacetate. Thank you for watching this video. See you next time.